You got
pants on?
Yeah, but not top on. Do you want to come in?
Yeah, that's okay. Go on.
Yeah, you all okay?
Yeah, all good.
Come on in. Thank you. Yeah, just in the gas, I'm just holding that really.
Don't worry, thanks Adam.
Come in, all of you. A lot of people.
A lot of people.
So this introduction, shall we?
Yeah, go
So
ahead.
Adam, my name's Natalie.
Yeah.
I'm a pre-mental health professional.
Right. Good.
And I work for...
Want to stay in here?
Turn the gas.
Oh, yeah.
Come in here.
Yeah.
Yeah, I don't know where they are.
Go ahead.
I can ask him.
Go ahead.
Want to have a seat then, Adam?
I'd rather stand, but please go ahead. Yeah, absolutely.
So Adam, as I was trying to explain, my name's Natalie Burkett.
Right.
I'm a pre-mental health professional.
Right.
And I work for Holton St Helens EDT
Right.
social work team.
Yeah,
Okay, my
sure.
colleagues will do their introduction.
Go ahead. Yeah, please, go ahead. Go ahead.
Hi, my name is Kenny Bamidili. I'm
Hi,
on
Ken.
call.
Right. Okay.
And I'm Dr. Ratman. I'm an independent psychiatrist.
Right, okay. Hi. You right? Okay.
So Adam, we've had a request for a mental health assessment
Right.
because people have been quite concerned on the recovery team that your
Right.
mental health's been deteriorating over a period of time.
Okay, and I disagreed with that.
Yeah.
Yeah.
I think that's the problem because that's why this request has been initiated. Okay?
Right.
So because you've not been taking medication.
I have been taking my
You
medication.
have, okay.
Yeah, do you want to see it?
No, that's fine.
That's a lie. Has that been written down?
Yeah.
That is a lie.
We can address that. It's not
Well,
a
let me
problem.
show you.
No,
You're
no,
assessing that. No, to be clear, two people assess. Right, one perception. That's what you're both there for. So I'll show you my medication.
3 people, 2 doctors.
Yeah,
and
right. What are you doing here? You're assessing first. That's the law.
Yes.
Right, so I'll show you my medication.
Okay,
Go ahead. Thank you. Come on.
Can we bring it in here?
Yeah,
Adam?
we'll bring it down.
We'll come down with you. Well, you come with me so you know how to
we'll
mess
bring
with
it
it.
down. Yeah, let's
Right,
bring
come
it
with
down.
me.
What is the difference?
You're compliant to medication.
This is message here. I think this is a message here.
Okay, so one thing there. Okay, this is my meds. It's normal.
Yeah.
I'm due them again in around about a week, so I need to fill it out. As you can see. Okay? Yeah, so I've been taking them every night. Absolutely. You know? Yeah, 100%. So that is the first lie
Okay.
of the mental health team. Okay? So,
Have
so
you,
is that.
have you been engaging with the recovery team?
Yes,
You have.
absolutely.
Okay.
Yeah, I had flu. I've seen the doctor on the 15th. The mental health team said that was fine. Okay? Because I had flu, so I didn't actually go there for the last meeting. That's it.
When did you last see them?
Yeah, I'm not a harm to myself or anyone else. That's the main reason why you section someone.
Okay, so when did you last see them?
Around about 2 or 3 weeks ago.
Right. So when you had flu, did you ring up and tell them?
Yes, absolutely.
Okay.
I have done.
So there's
A number of times. I told the receptionist a couple of times. I asked them to cancel the appointment because I had flu. Afterwards, the nurse, just after the meeting, straight after, rang me and said, I'm saying I'm fine. And she said, yeah, and it's my choice. Mental health allows it to be my choice. I have flu. Please, I'm seeing the psychiatrist come on the 15th to my home to not even to assess, but to go through how I am right now. That's it. Okay? I mean, to go through what I'm doing, let me show you as well, all of you, because you're supposed to assess me here first before the concern. That's the law. The law changed this year. The law changed this year. To be clear, it's not the same as the last year law. Okay? Right. Thank you. Right. So I'll go through this now. so show you my calendar. It's fine. Don't worry. So I upset. You understand why?
I know, you've got strangers in your home, and I understand.
Well, it's not that. It's just doing the same thing I've done before, and it's upsetting.
Okay.
You're supposed to test me here before anything else and so on.
Absolutely.
Right. So today I'm working on apps. Clean lounge. Okay. Apps in the evening. Clean up. Yoga. Prayer. In bed. Sleep. Okay. That's. I'm just showing what I do during the day. Running. Prayer. Clean kitchen. Towels. And so on. I'm maintaining my health and everything like that. I can show you my fridge. What day does it say? Saturday or Friday?
You don't need to show me your fridge.
But am I eating correctly? Okay. Please, don't panic. I'll show you my body.
It's alright, no, we see
I'm healthy. Anyway, there's no actual cuts on my arms or anything. There's like cat scratch there. Okay?
Okay,
Right.
can I ask you some questions?
Go ahead. Thank you. Just go through it. I really appreciate it.
What's with the phone calls to the police station?
Which one?
You're constantly calling police.
I have not been constantly calling the police. That's a lie.
Don't call police station incident within this past week involving a rabbit, toy. Talk to us about that.
Oh, you see the air filters there?
Yeah.
Okay, my neighbours have been gassing my home. Okay, basically, you know.
Talk to.
Yes, there is a vast amount of evidence about that with organised crime. That is accurate, basically. I have a drive full of evidence about it that multiple authorities have connection to. Anyway, and I've also, my mental health teams themselves, through the last 2 years, have been saying, well, we're not actually certain where psychosis is because you keep producing evidence it's accurate. To be clear, okay? You can see the evidence themselves as mental health teams. So is that what I've been showing them? Both sides' neighbours have been gassing the rooms anyway. They've been going either drilling through the corners or upstairs under the carpets. I have air filters in each room, things like that. One of the gas, a few days ago, the gas was really sticky on the floor, so I got one of them and just basically put it in a bag. And some authorities, when I text myself, are aware what I'm saying there, basically, and follow that. And therefore, one of the gases was full of this gas. Just put it in a bag, wrapped it up, and wrote it on it. Assumed the local police would get it straight away, because that has been happening on different occasions. But they've indicated there's been a in between. They weren't aware of about their actions. So there's that, you know. Okay, but that's been the only contact I've had with the police, except for themselves warning my neighbours, because they saw CCTV of harassment and things like that anyway.
So why
And they've given them warnings about that at least of harassment. You didn't see my home, it's pretty well kept.
Just interject a moment.
Yeah, go ahead.
They just need to ask some questions. Is that okay?
Yeah.
Thank you.
why the neighbours are doing that to you?
It's a long-running thing that's been going on since around about 2007, 2008. Around 2021, that mob group put in more, was more of a concern, basically, until this year, basically, where it's been a really difficult year with that, basically. Both sides neighbours and both sides neighbours and I believe some of the other neighbours in the area, for example, even to, I hate to use the term gay people, but a few doors down, when I first knocked on their door when I first moved in here, just to introduce myself to neighbours, they said behind their door, it's him, we're going to frame you, by the way, then opened the door and said, oh, hi. And it has been that all the way through in this home. I had to move here because they asked to, I was being, what's the word for it? I'm nervous, you know, please. I've been sectioned before, it's horrific. Absolutely, especially how I've been treated there, absolutely horrifying. Other authorities know that anyway, very, very, very horrifying how I've been treated that way. But if I produce evidence, then what do you section for? To harm yourself or someone else? It's the only law there, to be clear. So please, anyway, so yeah, I was, I've forgotten the name of it now, so I'm nervous because you're all here. But basically, I had to leave the last property in Widnes, basically, and I found this property and moved here. So there was that, you know.
Just so you know, we're not here to defame our section. That's not what. That's not.
Bless you. It's not an assessment first if you need
Absolutely.
to. I really appreciate that. Thank you so much. I'm shitting my pants just to say, but I really appreciate it. Thank you.
When you were in Widnes,
Yeah.
the neighbours from there also,
Yes.
they started to gas.
Yes, it was worse. Yes, they did also, and a little bit in Fulwood before that. That began around about 2019 in Cambridge. Yes, in that kind of manner, basically.
Why are people after you like this?
I can't open up enough about it. currently. To
Could
be
that
honest
be your
with
mind
you.
playing tricks, do you think, Adam?
No, would you like even one piece of evidence? Just would that help? Even a little? I know what you mean, but that's talking about delusional thinking anyway,
What does
and
that
so
say?
on. You know, and therefore that's not belief you harmed yourself or anyone else. So perception. But I can let me just. I just have a piece of evidence even on my phone, which will help. And I have videos also, and so on. So there's that, but I'll just scroll through.
If you don't mind me asking,
And I'm just shaking a little bit because of the nerves, but I'm fine.
yeah.
I have screen. In fact, I'm in the wrong
You're
bit.
doing
Just
well,
go to-
so don't worry about it. You're doing well.
Thank you. I just go to screenshots alone. Sadly, it's a difficult thing to actually find legitimate screenshots.
What are these screenshots of, Adam?
This is what I, without being horrific. For example, there's been a setup online on an adult site, and I have some screenshots of it here, but nothing that I've been able to show my mental health team that previously. Lily, my old nurse, and the one after. Not so much this one. I haven't been able to communicate this one as well, but I've still been able to. Okay.
What are these screenshots of?
Mainly the adult side where it even has the members' names that associate directly, even Adam sucks or Adam fuck you or something like that. Actually has
Adult
names.
sites, can you elaborate a little bit on that?
Yeah, to be clear about that, I've been writing to the Internet Watch about that, reporting children online in that kind of way, also for a long period of time. But it's, well, for the last 8 months through this setup, they were trying to frame me here with paedophilia, and they have been using gases at night time for that, that make it easier for them.
So those people are pedophiles, or they think you're a pedophile?
That's complicated, but they've been trying to frame me for paedophilia.
Who's they?
My two neighbours and the organised crime group online.
And how do you know that?
But there is links that I've shown the other nurses, which is quite hard for me to find right now. But the other nurses, Lily, and the one even before that, but the one before that, this association just said that I was
Why would
schizophrenic. But Lily herself has indicated, yes, I see that, and so on.
Bring it back a little bit. So,
Okay, to be clear,
why would somebody try and set you up to be a paedophile?
that's been going on. It began, I've been told it began with the triads, basically. I've been told that, it appears to be that way. Initially, in that manner, I used to work in a casino, and in that casino, there were triads there, basically, and I reached out to authority carefully and informed on that situation a very long time ago, around about 2023. No, 2026 in the end.
Adam, could you tell us more about the chips you said were implanted in your body?
I did not say that to anybody. Did I say that? Oh, I did say that. You're right. Yes. Originally, thank you. I mean that is one that's. But originally, 2019, you can see the marks of that there. You can. In fact, do you mind if I take my? You are doctors, so do you mind? Appreciate it. Absolutely. The injections got better this year, so nowadays you can't see them physically. But there's marks, white marks on my body in different places where they've been injected. They are implants. They were from China, including my.
By who, Adam?
My neighbours have been doing it. It's like a Wendy house. Okay, but my neighbours have been doing it here, but that began in 2019, and then they did pain on my mouth.
So how are they injecting you, Adam?
You can see them there. They're like TV.
How did they manage to do that?
How do you get in the house?
Implant that?
Wendy house. They have blown ways into the home at night time.
So
They can get in without you knowing.
Yes, even when I'm asleep, not using the doors.
Okay.
Yeah.
when did it last happen? When was the last time this happened?
The last time I know they've been in my home, I'm shaking a little bit, was about 3 days ago, 4 days ago. The last injections in that way, possibly a week ago.
So what are these? What's the purpose of these chips being in
The
your body?
one, and a fine example is, there was one in my spine, basically, round about there. Yeah, I don't know if there's a mark, I haven't been able to see. But there was one in my spine round about there, and they implanted that one because I helped to spy, with assessing China, and Biden in the end, please let me finish. Biden in the end decided to put sanctions on China with the electronics at the time. Later, about a year or two later, I remembered it, China blamed me, and I got that injection in my spine for more control to make sure I don't even really considering.
Who was putting the sanctions on China?
Biden, America,
Right, okay.
government.
So what does that have to do with you, Adam?
I just explained, to be clear.
Are you on a special mission? Are you special
No, it's nothing like that at all. Thank you.
The
Nothing
question
like that.
what's the link with Biden and China?
I just explained.
You said you helped a spy, didn't you?
Yeah.
Can you elaborate on that? So
I was just talking to a spy about some stuff. Basically, says that again. It doesn't matter. It really doesn't matter at all. But as said, Lily, the mental health team, the lady before Lily, that nurse, she was aware of evidence, but was saying it was just schizophrenia.
Okay.
Lily, the nurse, said we know a lot of what you go through is real. Okay. So was the psychiatrist at the time. Okay, Dr. Finally, to be clear, okay,
Yeah.
said we know a lot of it is real. Okay. And the newest psychiatrist in 2015.
Do you believe you've got a diagnosis of schizophrenia?
I think it's a bit more complicated than that. And over time, I'm hoping for a re-diagnosis. But I'm not running around my house crazy.
No one's saying that you are.
No, I mean, you can see I'm talking rationally about stuff anyway. Your assessment there is it rational if you believe he speaks to spies? I absolutely understand what you mean there. But that really isn't really a mental health assessment if you harm to yourself or anyone else.
Depends on a lot of other factors as well.
It's like a shoot can ask.
Yeah.
Go ahead.
So it's not just about whether you are a risk to yourself or to others. It's about a concern whether you deteriorate further.
Yeah. Which wasn't assessed actually at all. Although oddly my last nurse, it was strange because my last nurse, when I saw her last, she was acting a little bit that way with me.
What way?
But when I was just chatting to her, it was weird. And also I was gassed in reception, which was weird as hell, you know? In fact, they actually, because of being gassed in reception, I waited in the stairway.
Well, you was gassed when you went to the cover
Yeah.
room.
To be less cognitive. So I waited in the stairway, so they set the alarms off, and then the woman that was gassing one of the patients walked by. So then I sat in there. So then when I went to actually see the meeting, I wasn't really that cognitive.
Just so I understand,
I'm quite cognitive right now.
Clarify what you just said so we can understand. You went to a recovery team.
Yeah, that's what happened to the meeting.
Well, one minute, Adam. So
Yeah.
you went to a recovery team. They gassed you.
One of the patients, a female patient, had a Bauchi gas, basically in the reception area. She was the only one in there at the time. So I waited in the stairway. So the NHS set the alarms off. So everyone left, and she waited in the stairway too. Instead.
Recently, or not?
Pardon?
To do with the rabbit recently, is that the one?
What's into rabbit? That is that.
This is a separate incident you're talking about.
Yeah.
That's from the neighbours.
Okay, sorry. Okay.
Yeah, I'm very happy that the
Apologies.
psychiatrist is going to come here instead. Honestly, so we can chat about it.
Why did the woman there gas you?
It looks like they were playing a trick to have me instead, sectioned instead. So this organised crime gets away with it again, like they did in Bournemouth.
How do you feel about that?
It's very, very, very upsetting.
And how do you react to that?
Being upset.
What do you do when you're feeling very upset? What are you doing when you're feeling very upset? What's your reaction?
I just did it then.
To protect yourself, though, I think that's the question. So you feel under threat by a number of people. How are you protecting yourself? How does that make you feel?
I just did it then.
Did what?
Like I sent that toy to you.
Yeah.
With the gas on it.
Okay.
That had gas on it.
Yeah.
You can smell it.
But would that have been safe to take that to police station?
It had gas on it. It's evidence. What's happening? I should have rang first, is what they said, and they were correct. I should have rang first. It's that simple. Still had gas in the toy. I didn't make the gas in the toy, did I? It had gas in the toy.
Adam, just calm down a moment.
Sorry.
Okay.
Right. I'm just saying. There's evidence even on that toy.
Okay, so when you were in the Brooker Center and
Yeah.
the alarm went off, what was your reaction to it?
I still went to the meeting.
Uh,
I went to the meeting, but Sash D, whatever her name is, she's half 3/4 way through. I was telling something about happening, and she was on about. She said at the time, halfway through, delusion. I said, no, I mean, good, blah blah blah, like I said to you, and that was it, you know. So is that? I mean, don't get me wrong. I'm working on apps in my free time. I've got a YouTube channel that I'm building content for.
Can I ask what you mean by so what apps are you working on?
Oh, a character app, but basically, it's a virtual pet app. I'm a 3D artist.
Oh, okay.
So yeah, I mean, my last job finished around about a month and a half. No, it was just after Christmas, basically. After after that, I wanted time out from working freelance. Basically, I'm a lead artist as well. I have a BA Honours in Game Design, Masters in Animation. I got a highest mark in the University of Lancashire for BA Honours in Game Design in 2006.
Congratulations.
Oh, it's highest mark in the whole Lancashire, not just Bethesda. I finished my 3D job at Christmas time, and after that, I've been. Let me think a second. I've just been working on. I did some YouTube videos, all that kind of stuff, which I showed my notes anyway. Again, it's a question that I'll talk to you about it if you really want, about delusional thinking and everything, or what you're harmed to that, and so on and so forth. Because you're allowed to have belief systems by UN and UK rights, you know? So if you believe in that kind of way, whatever you feel like, as long as you're not harm to yourself or someone else, it doesn't really matter. Yeah, and the law of that has actually been reinforced recently even more in that kind of manner, definitely.
Do you think that
So I'm happy to tell it to you, but it's not a harm to yourself or someone else. That's the point.
Adam, my question is the belief that you have.
Yeah, go ahead.
Do you feel there's a possibility that it could be like a delusional belief in any way?
What is a delusional belief
From
itself?
your perspective.
No, I'm asking, what is a delusional belief? If I'm cognitive, I'm being cognitive with you, if I'm nervous, right? Right, so if it's in my harm or not, it's really what you mean. So, I mean, I'm allowed to believe there's dragons as long as I'm not running outside with a sword trying to get one. Really? You know, as much as you're allowed to believe anything on your tattoos, what are they for? It's your belief systems.
Yeah, no, I
Right.
understand that.
You know, maybe spies do talk to me sometimes, and sometimes they're bad spies, sometimes they're good spies. Maybe I'm a really intelligent person, that was the reason for that. Maybe it's other stuff. Does it really matter?
Why
No.
would spies talk to you?
I just said,
Are you like involved in a special mission or something like
No.
that? Or?
no, I just give advice from time to time.
Oh.
You know, this last week has been a bit of a crap storm with that. I just give advice from time to time.
What sort of advice is that?
For example, the van war, I gave some advice on that over the since it began, and just before. That was it really. Things like that. The last week, the advice the government hasn't agreed with and they didn't follow through with, and that's about it. And it's fine. You know, they have different information anyway. So there's that. And I haven't been able to really keep up with events anyway, enough with the resources I have. You know. I kind of balance that, but I've been balancing that since 2006 anyway. You know, I like to stay really informed. You know?
And without just,
Go ahead.
advising-
No, I'm not on a mission. But thank you. That you can place that to write it down as Sashi did. You know.
Adam, with all
Surely.
these activities you
I mean,
have,
there is UN and UK
Adam,
rights.
Adam,
To be
Adam,
clear,
Adam, sorry to interrupt you again, but we just need to ask you some questions.
go ahead.
so
Thank you.
my question is, with all these activities that you've had throughout this week and before,
Mhm.
how
So, yeah, relatively not so bad.
How many hours in a day?
About 7 hours.
Is that at night?
Night time.
So when you wake up, you're refreshed?
Yeah, generally. Yeah, in fact, actually a bit more this week, a bit better. Yeah, I can show you. Yeah, I'm eating. I'm a top chef. I mean, I used to be second chef at a casino. I actually have. I'll show you some recent photos. Do you want to see some recent photos of my chef? That'd be easier to find.
No, it's
Right. Yeah. So there's a little bit of problem with nutrition. I need more nuts in it in my meals and that kind of thing, which I've studied recently. But no, it's no problem. To be honest with you, I mean, I have it's mainly Japanese menu, which is really nice. There are a lot of tofu, Japanese. I haven't been working out as much recently, so I changed my menu to suit, basically. You know, so there's that. So I eat 3 meals a day. It's nice food. It's very it's posh food. I can put it on Instagram while I'm eating it afterwards. It's really good food. Like I said, I used to be a second chef before this PDR. You know? Yeah. So there's that. So sleep I'm okay with. Food I'm eating well. I want to change my menu a little bit because now when I'm able to, I want to start working out again. Basically, a
How
bit
is your
more.
mood at the moment, Adam?
To have weights after working out and things also.
How's your mood?
My mood. Okay. Nervous right now.
Before we came,
Yeah. Before you came, managing basically.
the
Definitely
high,
managing.
low, normal,
Um.
you can get anxious at times with all that is happening.
I don't normally get too anxious. I think medium is the reality of it. As in, am I depressed? No. Mentally, I'm on a level where I'm in routines and everything. But as you can see, right now, I've been floppy all day. You know, but I'm in routines, but not so bad. I mean, maybe it's better if you actually, well, I guess we got this room anyway. Maybe not, it's a little bit dirty, but it's not unkempt as you can see by this room. You know, yeah, but I need to wash up, but I wash up every day. You know what I mean? So, obviously, for example, even just take that one small thing, I wash up, I kind of let my pots pile up through the day and wash up at night. So there's that, you know.
When you get really anxious.
I don't get really anxious.
Okay, do you use any drugs to cope?
Hell no, nothing,
No
nothing at
accusation,
all.
it's just a question.
Oh Lord, nothing, no. No, I use, I have your missile pad only. That's it, basically. Only. Just your missile pad, that's all. Yeah, and that's it.
When did you last take it?
That's right. Yeah, whoever wanted my forms that I've not been taking medicine, an absolute liar. And that happened before. And it has happened before.
When were you last in a hospital?
2 years ago.
3 years ago. Which ward was it? Remember? Was it in Fulton? Which ward?
Holton,
Pine Ward, Southport, was it?
No, I don't think it was. I think it was one. No, I think it was the one in Liverpool. Yeah, it was. Yeah, it's horrible. They really abused me now. I was assaulted twice or 3 times.
So that hospital is gone now.
Yeah.
They've got really nice one. New hospital.
Horrible.
Yeah.
But Liverpool, I was there for about 2 weeks. What am I doing when I'm in there? No reality. I mean, you know, literally, you know, and that's been an issue. You know.
Do you think you need to be in hospital at the moment?
What's the law?
I'm asking what the law is. I'm asking, do you feel at this moment in time, do you think that your mental health is stable and you don't need to be in hospital?
Mental health is okay. Physical health I need to work out a lot more. You know, in all honesty, I haven't really worked out properly. Haven't done a run, and I haven't been working out doing weights in about 2 weeks. But I have been doing yoga and Pilates. So it is down. You know, if I do a run now, I can't make the whole block. You know, mental health is still quite strong. You know, basically, it is still quite strong. Yeah. I mean, as you see, cognition-wise, cognition. Well, you're the doctors.
To be honest, cognition. So you just asked us which day it was. Which month?
No, I didn't ask you which day it was. It was earlier on. I wasn't certain whether it was Friday or Saturday. Yeah. It is April. I think it's the 3rd or 4th or 5th. You know.
And what year is it?
2026. Yeah. For example, I just got paid my PIP a day ago. You know, my budget I keep track of.
How are you coping with your money matters?
It's okay. It's a little bit tight. I'm gonna have to start getting work again. You know, basically. That's the point. Definitely. Yeah. I only work part-time to maintain my mental health. You know, it's the bottom line. No matter whether you see it as schizophrenia or not, I'm maintaining my mental health. No matter how you see it, I still have the same problems. You see what I mean?
Okay. So my question is, with all that is happening now, more and more people are trying to gas you to the extent.
That's not what I said.
Yeah, can I just...
That's not what I said.
All right, okay, you can correct me. You even went to your GP, to the...
I said the neighbours on both sides, the police have evidence of that, with that toy at least.
So you even went to the recovery team, and even there a woman tried to do that to you. So how do you think...
And the nurses in the recovery team have said, we are aware a lot of what you show us is real.
So how do you think, where do you think that's going to take you with your mental health? Because that's worrisome, isn't it?
What you're trying to tell me, really there, truly, is that, what is your interpretation of mental health law?
What do you mean?
Why are you asking me that question?
We're trying to assess you.
Right, so ask again what you, ask within mental health law what you're trying to ask again.
Okay. So where do you think things are going to lead to? Because things are obviously getting worse.
Okay, if somebody, mental health law, my neighbours have already been warned from the police anyway, on camera for abusing me. First off, it's harassment. That's a police record.
Did that stop them?
No! Right, so you're arguing because I'm not stopping my neighbour. I need to be in the hospital.
I'm not arguing.
I apologise. You're absolutely
your
right.
side.
I am upset because you know, covering up organised crime is not the way forward. Do you understand?
I'm not here to pass any judgment.
Again, I'll repeat again. That toy did have gas on that. It could not have made. One thing. Secondly, they have already been warned with CCTV that the police saw. That's that. That's a reality. The nurses at the Booker Centre have seen some of the things I've shown them that indicate, yes, organised crime may be targeting it. Okay? Regardless of what being said the last 2 months of Saturday. Okay? That's it. That's the truth of it. Now, please assess me more about my mental health. But don't ask me a trick question about whether it's okay to cover organised crime and if that's and therefore.
Adam, we haven't asked that question.
That's what she asked.
It wasn't.
Yes, she did. What?
It wasn't.
Where it's going, these attacks.
What you're asking is therefore, if that mental health issue is, basically, if the organised crime issue is a problem, you need to be sectioned. Is what you reference.
No.
Right.
No. So what we're asking is, things obviously are increasing with the gas and the.
This year was planned and the year before.
Let me finish a minute, Adam. So if it continues going the way it is at the moment, so you're getting obviously injections from your neighbours through the Wendy House, and there's objects that are.
Wendy House means that they come in the home without.
I get
Yeah, but
that.
you're misquoting to make it sound like it's delusions.
That's not. No, not at all.
Because I haven't offered you evidence directly.
Not at all.
Would you like me to find some evidence directly?
No, it's okay then.
Are you certain?
Yeah, positive.
Because some of the references you've said sounds like you know the evidence already.
No, I'm only repeating what
To
you
be
said
clear,
was.
okay? Like you already knew that all the history as well. You said something too, and so did you. Right? Okay, fine. Right. No, please. Please. Assess more.
I don't think we need to assess
done
anymore.
that,
I
yeah.
don't. What we're going to do is we're going to step outside a moment, have a chat, and then we'll come back and let you know the outcome of the assessment. Is that okay?
Okay.
Okay.
The law is if you harm yourself or someone else, not if you have organised crime targeting you,
Okay.
or even if you see it as delusion.
We're going to say it obviously in here, Adam. Okay.
Yeah. To be clear. Can you come in here with me and I'll get the drink? Thank you so much. Now, you shut the door so I've got the cat.
Yeah.
Thank you so much. Thank you. Do you prefer a room call to witness or? Yes. Absolutely. There was an issue with the police in witness. What I went through there. Room call to fantastic. In all honesty, a lot better. I hope that.
Do you have regular contact with anyone in particular from Cornwall?
Yeah, I know people in the area.
No,
Basically.
police station.
Sometimes they even have a mental health.
Yeah, right.
Right. The laws changed a lot last year. Anyway, with mental health, I'm teaching mental health, and I'm also from Cheshire police being witness police was quite bad. To be honest with you. But it was a different dynamic that way of how government was or government has been dealing with this issue at times. There's that anyway. You know.
What do you think the outcome of their assessment will be? What you're envisaging?
Legally or illegally? Illegally, you'll cover the organised crime at that time and the time before, and I'll be 10 months. Well, I'm absolutely satisfied. I'm not on a mission.
And it's just me, naturally. Want to come back in? I'm on my own now. Okay, so I just chat with the two doctors.
Yeah.
And we're all of the opinion that you need to be in hospital.
Right, you know that's illegal.
If you let me explain why,
Mm-hmm.
okay? So right now you meet the criteria under Section 2 of the Mental Health Act
No, I don't.
for pre-assessment and treatment of your mental
I
health.
even offered.
I'm finished. Please let me finish. Okay. So you can disagree with that. You have rights under the Mental Health Act.
I don't have rights in the mental health act by how you're doing it. I gave you the actual evidence.
Adam, so you have 7 days. When it's the ward, you've got 7 days to request discharge at a tribunal. Okay. You have a right to an independent mental health advocate as well when you get to the ward. Okay. Right now we feel that you're very unwell. Okay. And we feel like you're relapsing into schizophrenia.
It's my life over again, huh?
It's not over at all because the ward you're going to is a nice ward.
Wonderful.
So how many cats do we have?
2.
Do you have anyone that can look after them?
No, you have to take them.
Well, I can't take them. You can sort them out.
Yeah, that's what I mean.